Question 70. Deferent duct, spermatic cord and scrotum. The deferent duct is a continuation of the epididymis, and it begins in the tail of epididymis and ascends behind, and it ascends in the scrotum contained in the spermatic cord and traverses the inguinal canal to enter the abdominal cavity. Here you can see this deferent duct. Here it has come through the inguinal canal into abdominal cavity, and here it crosses the external iliac vessels and inferior epigastric vessels. Here. From there it enters the lesser pelvis and running underneath the peritoneum and crosses the obturator vessels and nerves, and it also crosses the ureter. It descends between the urinary bladder and rectum, and you can see it is placed medially to the seminal vesicle. Here you can see it descends between urinary bladder and rectum, and it joins with duct of seminal vesicle to form ejaculatory duct, the red one, which opens into the prostatic part of urethra. The part that is placed medially to the seminal vesicle is enlarged to form ampulla. The blood supply is by artery of deferent duct. This is both superior vesicle and artery to deferent duct, so it follows the deferent duct. It comes from the internal iliac artery, and the nerve supply is from the pelvic autonomic plexus. Now the spermatic cord is contained in the scrotum and inguinal canal. It is composed of deferent duct in green, and also the vessels of deferent duct, of testicular artery, you see the red artery, and testicular nervous plexus, and papiniform plexus, which ends in testicular vein, and also lymph vessels. The spermatic cord is enveloped by internal spermatic fascia, here in green, by the cremasteric fascia and muscle, yellow. See the blue, that's the spermatic cord. And then you have external spermatic fascia, which is the blue. Lastly, we have the scrotum. It would be described as a cutaneous pouch. Contains the testes, epididymis, and spermatic cords. You have 2 testes, and 2 epididymis, and 2 spermatic cords. And the scrotum is divided by septum into 2 separate cavities. So therefore you result raphe of scrotum. You can see the subdivision by the septum. And the septum, the two separated cavities are called serous cavities of the scrotum. And the cavities are lined with the serous membrane, the parietal layer of tunica vaginalis, which is remains of the peritoneum. So the pink. And the different layers of scrotum is derived from the anterior abdominal wall. It's composed of skin, thin, brownish. It contains hairs and sebaceous glands, and scrotal skin contains no fat. And you have dartos muscle, which are smooth muscle cells, a thin layer of smooth muscle fibers. And you have external spermatic fascia from the external oblique fascia of external oblique muscle. Then you have cremaster muscle and fascia from the internal oblique muscle and fascia, and also from the transverse abdominal muscle and its fascia. Then you have internal spermatic fascia derived from transversalis fascia. The blood supply is by the external and internal pudendal vessels. Here you have pudendal. And the nerve supply is by the genitofemoral nerve. You can see it goes downwards here, down to the scrotum. This is genital branch of genitofemoral nerve. And also ilioinguinal nerve. This is anterior scrotal nerve from ilioinguinal nerve. And also the pudendal nerve, which is this one. You can also see here, pudendal nerve, those give branches.